Hi everyone, I'm Amanda Mason and my presentation is called Health Promotion for Older Adults. So I did my practicum at Seniors Outreach, which is a nonprofit organization located in Kelowna, BC. This organization links seniors to required services such as housing, financial, health, safety, and legal and estate planning. So during my practicum at Seniors Outreach, my role was to plan an 8-week meal preparation program called Find Your Inner Chef. So my tasks were creating and conducting pre- and post surveys, fundraising, basic fiscal management, health and community service navigation, and interprofessional communication and health promotion. So the goal of this program was to engage seniors to cook healthy and affordable meals that they could continue to do so in their own homes. So some of my tasks were, I said that on the last slide, creating and conducting pre- and post surveys, fundraising and everything. So while completing all these tasks, I made sure to incorporate the School of Public Health and Social Policy values, which were partnerships with people and populations served, interprofessional and multidisciplinary approaches, critical analysis of social justice and equity. So I made sure to view the seniors as integral partners in planning Find Your Inner Chef rather than just participants of the program. I created surveys to determine meal preferences, concerns, suggestions, and all of their input is going to be utilized for the next session of Find Your Inner Chef. Interprofessional communication occurred regularly to best meet the needs of all the stakeholders. The knowledge of my supervisor was required to lead me to the right health and community services that could provide me with required staff and supplies. The knowledge and skills of the chef were required to demonstrate how to cook healthy meals. And also the knowledge of the seniors was required to better understand what was working and what needed improvement. So the program had a lot of health and social benefits and has contributed to social change. Some of the female seniors in the program were used to cooking for families and the male seniors were used to being cooked for. So a lot of the recipes included meals for one, and there was lots of class material that provided information on health and nutrition, although health was not the only benefit of the program, as it also promoted social inclusion. So for the seniors who lived alone, it gave them an opportunity to get out, socialize, and learn with others. And the seniors that were caregivers, it gave them an opportunity to take a break from the stressful demands of that role. And the socializing aspect of it and learning with others and sharing knowledge can really help seniors to remain active and healthy in their communities. So unfortunately, not all of these programs can be sustained due to a lack of government funding. So towards program completion, I discussed with the seniors ideas for like a monthly or bi-monthly potluck that could be planned among the seniors themselves. And a registration sheet was created, and these ideas were discussed in hopes that some of the aspects of the positive health and social benefits of Find Your Inner Chef could be ongoing. So I think it's really important that we include population served as partners and that healthcare professionals can work together with them and generate ideas with them for ways to keep positive outcomes of a program lasting without having to rely on government funding. And just to wrap things up, I'm thankful that the Bachelor's in Health and Community Services can lead graduates into careers that will contribute to social change. And thank you.
So I hope that you all noticed the lengthy list of things she did in only 150 hours. But you probably put in more than that, didn't you? I would imagine. A little more, yeah. Questions for Amanda? Yeah.
Thanks. I'm wondering whether or not you explored community kitchens at all.
Sorry?
if you explored community kitchens?
We looked a little bit into that, but the organization had a kitchen that we used, but it wasn't very large. But yeah, we looked into using space from other nonprofit organizations. So that's where I did a lot of like health and community service navigation, looking for those supplies that were needed. But yeah, we ended up just doing it at the organization.
Right. Just because with community kitchens, so groups get together and make meals. So they share the workload, the task, and then they potentially get one meal, a dessert, and something to put in the freezer afterwards. So it's fairly sustainable, and it's a group process.
Oh, okay. Yeah, we didn't really look into much of that.
Thank you. Other questions, comments? Yes.
Hi, thank you. This is a really interesting subject. I was just wondering if you mentioned that lots of these seniors have been cooking themselves or for families their whole entire life. Did you ever get any kind of maybe resistance or a little bit of like kickback in terms of like, I have the knowledge, I've been doing it my whole life? Did you see any of that? Or was it,
we did. A lot of the participants were, well, not a lot of them, but some of them were already very experienced.
Yeah.
But it was in a positive way because they would be happy to share their knowledge with others. And so there was kind of a battle between providing simple meals versus a little bit more complex. But our target population was mostly towards those who didn't know how to cook simple and affordable meals. But it was good to see them sharing their knowledge with the rest of the class and being able to give their input.
Okay. Anything else from the audience? No? Thank you very much, Amanda.